The national disease burden of diabetes is unacceptably high. In 2010, more than a quarter of adult Singapore residents had diabetes and impaired glucose tolerance. The number of patients with diabetes is expected to increase to 520,000 in 2020. In 2010, 14% of the total disease burden was due to diabetes, and nearly two-fifths of the disease burden was due to the many diabetes-related complications. In 2012, 34% of the more than 50,000 patients discharged from Tan Tock Seng Hospital were coded to have diabetes. Hospitalization is an important opportunity to capture and influence diabetes care in our regional health system. Glycemic control during hospitalization is important. Both inpatient hypo and hyperglycemia are associated with increased mortality, complications, and increased length of stay. In addition, a period of good glycemic control generates long-term reduction in cardiovascular complications, the legacy effect. Hence, the importance of achieving good inpatient glycemic control and maintaining long-term HbA1c targets. Our inpatient diabetes care team, set up in 2012, covers 8 surgical wards, handling a daily average of 27 patients. It uses protocol-guided management plans to ensure medication safety, improving rates of hyper and hypoglycemia. Cooperation with NSGP has also improved the first attendance follow-up rate at NSG polyclinics and improved the mean HbA1c post-discharge. However, this pilot project has many limitations. 1. Labor-intensive identification and stratification of patients. 2. Intervention in only a limited number of patients, although all hospitalized patients with diabetes require proven care. And 3. The lack of cost-effective surveillance for outcome monitoring. Our current initiative will establish a Plan, Do, Study, Act cycle with 3 components: identifying patients, intervening, and monitoring and improvement of outcomes. Outcome data informs the system changes required to improve future outcomes, completing the cycle. Cost effectiveness is enhanced by risk stratification. Our proposed IT system will probe current hospital databases to identify and triage all hospitalized patients with diabetes into risk categories. Endocrinologist-led teams will assist the primary team in caring for high-risk patients. Pharmacists and nurses supervised by endocrinologists will improve the care of medium-risk patients using proven care packages. Ward nurses and pharmacists will support the primary care team of doctors to care for low-risk patients. Immediate outcomes tracked include fluctuations in glucose levels, adverse events due to glucose control, and medication error rates. Long-term outcomes monitored include HbA1c reductions, readmission rates, and attendance for follow-up. With closer ties to our partners, we aim to discharge the majority of patients to primary care. Thank you for your attention.